Thank you, Goni. So good morning, everyone. I'd like to start off by bragging a little bit and letting everyone know that Alpha One Canada is celebrating their 10th anniversary this year. Yes, thank you. I've been a part of the humble beginnings, and I am chair and president of the organization for 9 years. And so I'm not used to working these clickers. I have to apologize. Anyway, this morning I'll tell our story, highlight some current activities, let you know what's happening with our healthcare system, and talk to you a little bit about augmentation therapy reimbursement, and let you know what's been happening in Canada in the last couple of years. So to put things in perspective, we decided to create a few maps for you to let you know what, well, this isn't working too well, is it? I'm ahead of things here. Anyway, Canada is the second largest country in the world, Russia being the first and United States being the second. And however, by population, we rank 35th. And so we've put together some slides here to let you know how things work in Canada. If you can see, Italy is there. We're superimposed on one of our provinces. And there is the UK and the Netherlands, as well as Brazil is represented in the green. This is just to demonstrate how vast our country is and how complicated things are for us. We have 36 million people in Canada, which is 1/10 of United States, and the same population as the state of California. So a very vast nation, and this poses some significant problems for us. How we build and maintain our community is definitely a situation that creates problems with our vast country, and it impacts on how we do business. However, technology certainly is, we thank God for technology today. This is how we connect alphas with alphas, and how we do this by teleconferencing, social media, and virtual connections. Am I on? No, I'm not on track here. Alrighty. So this year we're trying something very different. We're excited about creating our new educational virtual summit. And the summit is arranged for over 15 guest speakers. They will be pre-recorded and uploaded to our website. We certainly hope that everyone gets an opportunity to visit our site, www.alpha1canada.ca. The sessions will be, as I said, pre-recorded, so our alphas can sit in the comfort of their home and at their leisure view and listen to renowned speakers. We certainly hope that you will watch our website and join us at that event as well. We also have a live session that will be going on, whereby we'll have docs present on a panel, and our alphas will be able to call in and ask questions. And we will also have patient panelists and caregiver panelists. So another issue that we have is testing and finding alphas and getting them tested. It's a challenge for us. However, we have found at least 25% of the patients in our database. The testing is complicated by a further issue, which I'm not too proud to say, but unfortunately Canada does discriminate in genetics, based on genetics in employment, life insurance, and health insurance. This poses a real quandary for our parents. They wonder if they should get their children tested, because that report is placed in their health record and follows them for the rest of their life. So it's another issue that we are certainly pursuing and trying to get our government to change those policies. We are very thankful to our American cousins. They allow us to access their anonymous testing. We refer our patients for this testing. The kit comes to them. It is then sent away, and none of their reports are recorded in their health record, which really helps. We are a part of the Canadian Coalition for Genetic Fairness, and we are certainly being instrumental in helping make that movement forward. Our Prime Minister has committed to change legislation and to certainly ban genetic discrimination. Another issue that we have in Canada, and we are proud to say that our new website is certainly helping to improve how we find alphas, and we hope you have a chance to look at our website. And wow, I'm so far behind here. Sorry. Anyway, we'll just keep moving along. So the website then, we hope again you have a chance to look at it. Please tell us what you think about our site, and if there is anything on there that you wish to copy or that we can share with you, we would be happy to do so. We'd certainly like to learn from many countries that are here today, and hope that we have a chance to speak with you so that we can collaborate as the Global Steering Committee wishes to do as well, and to bring our thoughts together and help improve the lives of all alphas. Another very difficult audience that we have are as physicians. Again, our vast country certainly doesn't lean well to finding those physicians, and unfortunately there are still some in Canada that are not aware of Alpha-1 to this day. Some of our patients leave their doctor's offices again with misdiagnosis, and an incorrect diagnosis, as well as no treatment plan. We are making inroads, of course, and we have sent out brochures and literature to every physician in Canada, and we go to medical schools, of course, and provide educational events. So things are moving along, and we're hoping that they move much quicker. Another area that we have difficulty with is fair and equitable access to augmentation therapy. And I know many of you are in the same boat. This creates some huge barriers for us and roadblocks. And one that you wouldn't think is a problem, but it is a hindrance for us, and that's our healthcare system. While Canadians pride ourselves on a wonderful healthcare system, it generally works well for those in the general population, but does not work well for those with rare diseases or expensive therapies. We like to say we have a national healthcare system, but in reality we have 14 healthcare systems. We have 10 provinces and 4 territories, and so we have to lobby, advocate for in all separate jurisdictions. And our healthcare system, while everybody thinks provides for everything, it does not. It does not provide for prescription drugs. So many Canadians have to go out-of-pocket expenses, or they have to have private insurance. So when it comes to expensive drugs like augmentation therapy, each jurisdiction, each province decides whether they are going to pay or not. And unfortunately in Canada, only 4 of our provinces do that. The bottom line, where Canadians live can have a significant impact on their health care, and that is unfortunate. So along with our Medical Advisory Board Chair, Dr. Chapman, we have submitted 6 submissions to the province of Ontario to change their decision to rescind paying for augmentation therapy. They did that for 18 years, and as a cost-cutting measure decided that they were no longer going to do that. And it's been 6 years now that we have been struggling to get them to change their decision. Unfortunately, that also leaves the remaining 9 jurisdictions without augmentation therapy. Many of them are poor and have lower populations, so there are some difficulties there as well. We understand with many of you, you're in the same boat, you're fighting the same fight, advocating with your government as well to get augmentation therapy. So we hope over the next couple of years, or next couple of days, that you will come and speak to myself, and my executive director, Jim Mundy, is here as well. Please come and talk with us and share some battle stories, wins and losses, and hopefully we can talk about the struggles. Another key focus, that we have had over the last 18 months is dealing with our children with Alpha-1 and their families. We have created a kids program that is a significant strategy, and we name it Aid One Kids. And we did that specifically as a branding to symbolize the disease, but also to incorporate that children are number one and they are important. These number of programs are there on our website. Please check it out, and we certainly offer peer support, support to parents newly diagnosed, and a lot of programming about them. The centerpiece of our program is Look at Us, We Are A1. We created a children's storybook, and as soon as I get it up here, you'll be able to see. There it is. Whoop. Okay, there it is. We are, Look at Us, We Are A1. It is a storybook for children ages 3 to 7 with age-appropriate language. And it follows 2 children, a boy and a girl, and it just is an inspiring book that hopefully engages parents to talk with their children. It just goes through the whole series of the things that the children will learn about their disease. And throughout their travels, there's 2 children, Liam and Sherry, and they are accompanied by their trusty friend, Alphazilla. And there he is. He's a stuffed green friendly dragon, and he has also become our mascot. And since the children's book has been really a positive undertaking, the children have given us some great response as well as their parents, we have decided to create Alphazilla. And here he is. So it's only a prop, it's not a prototype. I sewed him. He's in pretty rough shape. He's not too children friendly. But anyway, we're trying to mass produce him so that the children can take him to their doctor's office and take him to hospital when they go. So if anyone is interested, please come and see us. Another thing that we have done is we've created a new registration on in our database. We ask lots of questions to our patients that are willing to give us information so that we can compile data and about our community and identify trends and characteristics and identify families. And certainly this information is gleaming for us some really strategic thoughts about young children having breathing problems. And we're seeing it more in infants, in adolescents. And so by gleaming this information, we have an opportunity to pass that on to our physicians and to certainly let our parents know that they need to take significant care with their children and their lungs. And finally, of course, we're involved with all of the government situations around healthcare and drug coverages and how we try to make changes in that. And that's ongoing for advocacy is always there. So I would be remiss in not giving a great big thank you to our cousins in the South. Since our inception, they have been very generous. The U.S. have provided literature for us when we didn't have any. We went to their education days when we didn't have any, and we still go. And so just wanted to say thank you to John Walsh and to his consummate professionals. They were our advisors and mentors when we got started. So here we are today, and Alpha One Canada stands ready to collaborate and share our resources with all of you. We certainly hope you'll come and speak with us. Our Canadian motto is one that we would like to share with you. Together we can do so much more to improve the lives of all alphas. Thank you.